Okay, well, we'll get started. Welcome. Everyone has already muted their microphone. So I am Dr. Renee Matthews. I'm on the board of directors for the Chicago Asthma Consortium, and I'm a health educator, a content creator, a host, and author, as well as a physician. So today's schedule, I just did the welcome, and I will introduce our fabulous speaker. She'll speak from 12:05 to 12:20-ish, and then we'll have Q&A, and then we'll close out. So just a little bit of housekeeping. Attendees' video and audio should be off during the first half of the webinar, excuse me, and the closing of the webinar. Networking and communications, use the chat feature to introduce yourself and say hello to other attendees. If you have questions for the presenter, make sure you type those questions in the chat, and we'll look at them and we'll answer them at the end of the presentation. So just make sure you send that one to everyone so we can see it. And also at the very end, we'll have a webinar evaluation that you need to fill out, and the link will be in the chat. So please make sure you stay on to the end and you check for that. And if you have any technical difficulties, please contact Asher Robeson via the chat feature or by email at info@chicagoasthma.org. So the Chicago Asthma Consortium the mission is to seek to improve quality of life for those with asthma through advocacy, education, and collaboration. The purpose is to bring the Chicago Asthma Consortium is to bring together medical and public health professionals, business leaders, government agencies, community-based organizations, and individuals dedicated to raising awareness of asthma and improving the quality of life for those living with asthma. So help us make an impact. Learn more about how you can become a member and contribute at www.chicagoasthma.org. So today's presenter is my friend, Dr. Payal Gupta. She is a fellow of the American College of Allergy, Asthma and Immunology. I hope I got that right. Assistant clinical professor, SUNY Downstate Medical Center, medical director of allergy, asthma, immunology, and ENT at lifemd.com is her website. And like I said, if you have any questions, please post your questions in the chat, and Dr. Gupta will answer them at the end during the Q&A. And I think we can get started.
All right. Hi, everyone. So I hope everyone can see my screen. So today we're going to be talking about asthma in general, but then focusing a little bit on exercise-induced asthma. I don't have a lot of slides, so I really want this to be more of an interactive session at the end with all of your questions and anything that you're just wondering and wanting to learn more about exercise-induced asthma, we can talk about. So I have no disclosures. I just put that in just in case. But, first, what is asthma? And I think most people know, but just in case, I wanted to talk about the two primary things that are happening in our airways when we have asthma. And that is that, the muscles around the airways tighten more easily. So as you can see here, those are the muscles around our airways. And if they tighten, that doesn't allow for airflow into the airways. And then the second aspect for asthma is the inflammation or swelling within the airway tube. So you can see here, this is the normal on the left, and then on the right, you can see that it's very swollen and there's not as much room for air to flow in and out. And that's really the main issue, is that not having that open airway is what causes us to cough, wheeze, have tightness in our chest, and shortness of breath. And I personally suffer from asthma, so I know how this feels. I've been there. I've had it since I was little. And so, but it is very, it can be very hard on a daily basis for some people to be able to breathe, which is not nice. And so that's, generally the mechanism of action of asthma. And so there are different types of asthma. So there's allergic asthma, which your trigger, and we'll talk about triggers in a second, your asthma is triggered by allergens like dust, cats, dogs, pollen in the air, things like that. Then there's non-allergic asthma, where you're not triggered by allergens, but maybe you're triggered by infections and exercise or chemicals or smoke, or just internally, just you have a predisposition to producing inflammation. And that kind of leads into eosinophilic asthma, which is a certain type of asthma where you have these cells called eosinophils that are a type of white blood cell, but when they're in higher quantities and they're overly active, they can cause inflammation in the airways too. And then exercise-induced asthma, which is what we're going to focus on today, which is, where somebody has difficulty breathing with exercise. And so, I want to mention that all of these things, you can have different, so you can have allergic asthma and also have exercise-induced asthma. You can also have late onset asthma, have allergic asthma and exercise-induced asthma. So you can have multiple forms of the different types of asthma. And then cough variant asthma, which some people might have heard of, is where you only have the symptom of cough. So you don't have that classic wheezing, chest tightness, but people will cough. And that's called cough variant asthma, but it's really from the same kind of underlying mechanism of action. And then there's late onset asthma, which is where people don't have asthma in childhood, but they'll develop it later in life. So in their 40s and on. And so asthma is, we call them triggers when there are certain things that cause asthma to worsen. Okay. And that's what we call a trigger. So I found this fun picture online, but it's, there are a lot of possible triggers for someone's asthma. So even I think some of the more interesting ones that people might not have heard of are things like stress and anger can actually trigger someone's asthma. Pollution and smoke. So wildfires, all of the increase in wildfires that can also lead to people's asthma getting triggered, strong odors. So even perfumes and things like that people wear sometimes can trigger some people's asthma. Smoke, even if someone's not smoking around you, if you're in a space where someone did smoke, I know for me, that really affects me. Just even the smell of old smoke can actually trigger someone's asthma. And I think that's really important for people to remember. And so thankfully, a lot of hotels now are, completely smoke-free, but I think back in the day, that was a big, big issue. And then dust mites, pets, as I talked about, and then exercise, pollen. So that means tree pollen in the spring, grass pollen in the summer, and weed pollen in the fall. And then cockroaches, rodents in the home can also be triggers, and chemical fumes and other exposures. And then cold air is a big one. And then the viruses, which, different infections and viruses can also trigger people. So what is exercise-induced asthma? So exercise-induced asthma is a specific type of asthma where when people exercise, they start feeling that symptom of tightening of the airways, the narrowing, and they would have that symptom of coughing, wheezing, shortness of breath. So what kind of things are going on in the airways that's specific for exercise-induced asthma? So the airway hyperresponsiveness we've talked about is, that same kind of thing, which the exercise is the trigger. It causes the airway muscles to contract and tighten. But also another key component in exercise-induced asthma is this kind of dehydration and heat loss that happens during exercise. So the body loses water and heat through respiration. And then there's a cooling and drying of the airways that happens to really keep our airways cool while we're exercising. But for people with asthma, and specifically exercise-induced asthma, that natural cooling of the airways can actually lead to the irritation and inflammation that can cause them to start having asthma symptoms. And then the inflammatory response, which we talked about, which is the exercise itself can cause inflammation in the airways for people that have exercise-induced asthma. So that all contributes to that airway not being as open and as ready to take in and, allow us to take in the oxygen that we need. And then, so for exercise-induced asthma, if that's the primary asthma that you suffer from, the really 3 types of medications that might be used are bronchodilators, so short-acting bronchodilators. And what do short-acting bronchodilators do? They essentially help relax those muscles around the airways. So they kind of help relax those muscles. And that happens very quickly when you use a short-acting bronchodilator, thankfully, so that you can start getting air back into your lungs and feel like you can breathe again. And then now what we're finding with research is that actually we might do better if we have a combination of a short-acting bronchodilator combined with an inhaled steroid. And so inhaled steroid, again, helps. So steroids help reduce inflammation in the airways. So a newer medication that's coming out called AirSupra is approved in 18 years and older. And that is also something that may be used for people with exercise-induced asthma. And then lastly is the Singulair or montelukast, which is what we call a leukotriene antagonist, which essentially blocks this other chemical pathway in the response that causes inflammation and irritation of the airways. And that we have found can also help people with exercise-induced asthma. So that might be, if you exercise 3 to 5 days a week, that might be something that your doctor may prescribe because you can take that on a regular basis and it helps prevent you from having symptoms. So again, and usually we recommend for the short-acting bronchodilators or the combination of the short-acting bronchodilators plus the inhaled steroid, we recommend that you use that 20 minutes before you start exercise. And what that does is it relaxes those smooth muscles. So even if you do have a little bit of that inflammation or that irritation from the exercise, your muscles are already relaxed and ready to take on that kind of irritation. So that's a little bit about the medications that you might be prescribed. And I think I want to touch on the asthma action plan real quick, because I didn't put a slide in, but essentially, when you have any form of asthma, you are going to have what we call an asthma action plan. And what that means is that your doctor will tell you, what are your regular medications that you're going to be taking on a daily basis. Will be kind of like your green light. When you're not really having symptoms, you're feeling good, these are the medications that you're going to take. But then if you have exercise-induced asthma, you'll have another layer on that where it says, well, if you're about to exercise, then you're going to want to add in one of those, either the bronchodilator or the short-acting bronchodilator with the inhaled steroid combo 20 minutes before exercise, so that you can always refer to that piece of paper as a way of knowing what your plan will be if you're going to be doing different activities, right, with your asthma, especially if you have exercise-induced asthma. And so, or that you're going to be taking them on to montelukast the night before. And so these are the kind of things that will be on your asthma action plan. And then also it'll have a yellow zone and a red zone, so that if you've done all of these things, but then you're still having symptoms on top of that, and you're still feeling short of breath, feeling that, your airways are getting tightened, that you're not feeling like you're able to breathe, that then you have a secondary plan of action, which might be to take another dose of your short-acting bronchodilator within like an hour or 20 minutes. So anyway, everyone's plan is going to differ based on their asthma. And so it's just really important for everyone to touch base with their doctor, whether it's your primary care doctor that's managing your asthma, or if you have an asthma specialist like an allergist or pulmonologist. But at any time, if you feel like the medications that you're using are not working for you, you really want to check in with your doctor and potentially even then self-refer yourself to a specialist if you don't feel like you're getting the help that you need. And then other things that I wanted to mention in the therapy area is that, I was just talking to some colleagues and we were just doing some brainstorming on how we can help more asthma patients. And one thing that came up was that a lot of patients, a lot of people actually don't perceive their asthma in the same way that a doctor might perceive their asthma once we ask certain questions about how their asthma is doing. And I think that's an important top point that I just wanted to bring up today, because we as people with asthma, sometimes you've been breathing a certain way for so long that sometimes you don't realize that you're actually not breathing as well as you could be. And so if you feel like you're using your rescue medication or that short-acting bronchodilator more than 2 times a week, if you're waking up at night more than 2 times a month, because you're not breathing well because of your asthma, if you feel like you can't even walk down the street without being short of breath, that's actually not where we want you to be. There's something that's not right in your asthma treatment plan, and we can change that. And, I'm really excited because I've had asthma for so long. My mom had asthma, and I've seen the trajectory of where asthma treatment has gone, right? And now we really have a lot of asthma medications that can help people with moderate severe asthma. And so I think it's really important for everyone to realize that there are many, many options that we can use now to help somebody get their asthma under control. And also I want to quickly just mention about the ER. So using the ER as your primary kind of avenue of getting asthma management is also something that I am passionate about talking to people about, because that space is really meant for emergencies, right? So those doctors are really trained in a very specific type of medicine, which is emergency medicine. So they're meant to just help you in that moment breathe better. They're able to help that person that's having issues with their heart in that moment get better. But then moving forward, to prevent that from happening again, you really need to see a specialist who can put you on what we call controller medications to help prevent you from getting to that point where you're needing to go to the emergency room or urgent care. So again, there's lots of medications out there and that are much better than what we used to think we only had, which was the oral steroids. So oral steroids like prednisone are really, really bad for our overall bodies. And so we want to try to reduce our use of those, and having to use those more than once a year means that something's also not going in the right direction for our asthma. So those are all my, tidbits about all the things that I always want to kind of focus on whenever we're talking about asthma. And then, going back to exercise-induced asthma. So if you have exercise-induced asthma, does that mean that you can't exercise? Absolutely not. Okay. It means that you absolutely should exercise. Sorry, that was like a double negative. It means that you absolutely, absolutely should be exercising. And if you're not able to exercise, again, that means we're not doing our job right. That means you're not on the right medications to help you be able to do what you need to do. I mean, if you're sick with a cold and your asthma is not doing well, at that moment, you may not be able to exercise, but many people can't exercise when they're feeling sick, if they have asthma or if they don't have asthma. So yes, there are moments when maybe exercise isn't the right choice because it might flare your symptoms more, right? But in general, even if you have exercise-induced asthma, you can absolutely exercise, and it's very, very important. And I'll talk about that in the next slide. But how can you exercise, and what are some key things that you can keep in mind for if you have exercise-induced asthma and you want to exercise? So it's really important, number one, to take, to look at your asthma action plan and to make sure that you're using the medication that you need to prevent the symptoms, like, the 20 minutes before medication or the night before medication. Number two, you really want to do a nice warm up and get your lungs ready for exercise. And then make sure that you're doing a nice cool down for your lungs and like kind of helping your body kind of relax from that effort that you just put in. So a gradual warm up and cool down exercise can really help reduce and prevent people from going into any kind of like severe asthma symptoms, even if they have exercise-induced asthma. Also, listen to your body in general. If you're feeling like you're overdoing it, if you're feeling like your body can't do it, then that's a time to slow down, right? So, if the warm up feels like where you want to be, and if you start doing more and it doesn't feel like you can do more than that, then just stay with the warm up and don't extend yourself further. So it's important to listen to your body, but you still want to be active and do things. The other thing is you want to stay hydrated. Staying well hydrated can help reduce some of the irritation that's caused by that dehydration that we were talking about earlier that happens during exercise. So that's actually very important for your whole body, but also for your airways. It helps them stay hydrated and doesn't cause that irritation that causes the airways to tighten up. And then avoiding triggers. So if you feel that cold air is a problem and it's like middle of December, maybe working out outside isn't the best option, right? So if cold air and exercise bother your asthma, then maybe you want to do your exercise indoors during colder months. Or if it's springtime and it's high allergy season, you look at the pollen count and it's like moderate high, that's a time that you probably also don't want to work outside. So thinking about those things and where you should be exercising is also important for making sure that we, reduce our symptoms with exercise. And then I talked about the asthma action plan first, which is just, making sure you're using the right medications. And then why is exercise so important? Well, it's important for our general health. It's important to keep our body weight at a weight that we want it to be, that's healthy, because we know that obesity actually can increase inflammation in our bodies, which means that it can increase the inflammation in our airways and can make asthma worse. So we really want to do everything that we can to stay at a healthy weight, and exercise is one of those tools. And then exercise also helps to improve our lung capacity, or the amount of air that your lung can hold, which is also very important when you have asthma. The larger your lung capacity, the easier it is, even if you're having an asthma, even if you're around a trigger or if you're having a little issue with your asthma. And then also exercise helps to strengthen the breathing muscles that are around our rib cage and all of those areas. It helps strengthen all of the muscles in our body, but also the ones that are around our that allow us to breathe effectively. And then exercise increases the blood flow to your heart, which helps pump oxygen throughout your body, which is super important. So that's really it. This is my son a little while ago. He's rolling along. Now he's actually riding his bike and he's just 3. So anyway, things move fast. Our knowledge of asthma keeps growing, just like these little kids. And so it's really important. If you feel stuck, I really want you to look further and look for more help, because there are a lot of options out there, and maybe you just need to talk to a different provider if you're not getting the care that you need.
Thank you so much, Dr. Gupta. I also have asthma, as she knows, and so I related to everything she said. And also, I was one of those people, but my doctors knew and they were taking care of me, but I didn't know how my breathing was so shallow compared to others until my asthma was well controlled. And I was like, oh my God, I can breathe so much better now. This is amazing. But yeah, definitely make sure that you seek out the help that you need. If you need to get a referral, get the referral. If you don't need to get a referral, then ask people and find out who is the allergist or immunologist, pulmonologist in your area so that you can get the best care ever. Because the one thing that I love about the PCPs is that they will do the best job they can, but they don't go to all the fabulous, wonderful conferences that she goes to get all of the latest and greatest treatment plans and understand all of these new drugs. There's all these, amazing drugs on the market. I'm 46, I'll be 47 in a few weeks, and my God, they're so much better than what I was taking when I was like 5. So definitely please make sure that you guys do that. Let me make sure there's no questions here.
Looks like there are a couple.
No, just some comments, I think.
The
Yes.
last one is review of ICS LABA as a quick reliever.
Oh,
So
yeah.
yeah, so there's also the SMART therapy, which is the inhaled corticosteroid and long-acting beta agonist combination, which is called SMART therapy. So that really is for patients who have moderate to severe asthma. The recommendation is that as their quick reliever inhaler, the use of that inhaled corticosteroid LABA combo as not only just their controller medication, but also their quick reliever to kind of give that extra dose of inhaled steroid to reduce the inflammation in the airways during an exacerbation could be helpful. And I absolutely agree with that. I think I remember a long time ago in my training when we used to think about that and talk about it, I was like, everyone's like, no, it doesn't work. It doesn't work. And I just could not intuitively understand why it wouldn't work. And so when this study came out, when the treatment guidelines started to change recently, I was like, okay, that made sense. It really makes sense that using an inhaled corticosteroid would be somewhat effective in helping patients or helping people with asthma who are having that acute inflammation and tightening of their airways. So I absolutely, you know what? I thought it was for mostly moderate and severe for the quick reliever, but I think actually now they're even moving to recommending it for all patients as their quick reliever choice. The only problem with that is that insurance takes a while to jump on new recommendations. And so although it might be helpful for everyone, it is going to be harder for people to get that as their intermittent use inhaler. So yeah, I think it's a great choice for everybody. But that would be the ICS SABA, but only for step 3, not below. So you're saying that, I'm sorry, I don't know if I think this is a physician, if he can unmute himself and we can have a discussion about it, it might be easier. I think over texting, it's harder to have a conversation. So Asher, I don't know if you can unmute him, and if he'd like to say whatever comments he wants to, he's absolutely more than welcome to.
Maybe he can't talk wherever he's right now.
Okay.
Yep. He said he can't unmute from his end. Asher, are you able to do that?
Maybe everyone was muted now. I think he sent you a request to unmute. So now you should.
Oh, there he is.
Hi, my name is Mark Rubin. I've been with CAC for a number of years, used to be on the board. With Quad AI, I've been on the Sports Exercise Fitness Committee for about 15 years and involved in the EIB guidelines. And the latest GINA guidelines, 2023, is stating that the short-acting beta agonist ICS combination really is showing no benefit when you're dealing with mild intermittent, mild persistent, where the ICS long-acting beta agonist is. and using it through all the 3 steps. It still isn't as part of the expert panel because it takes longer for those to get reprocessed. But the guidelines are showing, their research studies are showing that the combination, and where you can prescribe both medications, is you would be using the low dose combo of either Symbicort or Dulera, the lowest dose, as the quick reliever. And then you may be using the everyday one, which could be a little step up dose for your controller if you're taking the controller. And if you're doing the combination of the both, my thought is going with the Dulera for your maintenance, because you could say Dulera daily, and then the Symbicort for symptomatic relief, because that way it would be 2 different dosages, and you're more likely to have the insurance company cover both medications.
I mean, I don't know how they would cover 2 ICS LABAs in combo. But if you had
difference.
success with that, then even though they're like, so then they'll say that they're both in the same category. And why are you prescribing 2 medications in the same category? That's been my experience in New York City. But maybe in Chicago, or, you're having a different kind of outcome with the insurance companies. But absolutely, I think these are the conversations that you absolutely should be having with your provider. I think today was just a general kind of overview on the different options, but absolutely, Dr. Rubin, you're correct. I think there's lots of different ways that we can do the quick relief now. We have different options depending on what's covered and depending on, the patient and what their history is. I think you can decide what option would work the best.
Well, thank you so much for everyone that joined us. And if you would please fill out the survey, Asher will put that, there it is. The link is in the chat. So please fill out that survey. And for more information about the Chicago Asthma Consortium and any upcoming events we have, visit chicagoasthma.org. And any other questions, you can email our association manager at info@chicagoasthma.org. Thank you so much. Have a great afternoon.